In this video, we will overview the process of using the Banyan Virtual Nurses as second RN skin assessment witnesses when providing a admission skin assessment. The first thing you want to do is contact your virtual nurse via Tiger Connect. You can let them know that you have a new admission and you would like to complete a skin assessment, and this should be completed 4 hours after the patient has arrived to the unit or within the 4 hours that the patient has arrived to the unit. So you can let the virtual nurse know what is the best time and you guys can work together to find that. And then you can both meet into the room, virtual nurse via camera, to provide this skin assessment. If for some reason the virtual nurse is not available, it is okay to utilize another bedside nurse. Or if when you are providing the skin assessment, there is an area that the virtual nurse is not able to visualize or they do not feel comfortable witnessing, it is also okay to do the assessment with another bedside nurse. The virtual nurses will only be able to witness for present on admission, location of skin abnormality, and appearance. They will not be able to see tunneling, or if it's not within their visual view, like if we're not able to turn the patient fully, this may also be a reason why they are unable to witness. After the bedside nurse and the virtual nurse have assessed the skin together and have agreed upon the pressure injury or location of wound, then you would be clear as the bedside nurse to chart this. For example, we would use a skin abnormality like this one as an example. As a reminder, the virtual nurse is only able to assist in the admission assessment of the skin. So if you are documenting this abnormality, you would log in and first start your band. Once you have created the band, you are clear to start. So if you're documenting a pressure injury that is present on admission, you would do that. You would put the time and day that you are completing this, and if it is a community acquired pressure injury. When you're documenting the abnormality, again, you would choose the appropriate type of wound for the patient and what you agreed with the virtual nurse. Again, staging is what was agreed upon with the nurse, and here it will prompt you to input the name of the person you are witnessing with, so you make sure that you know the name of that nurse. For this, I am going to use myself as an example. If you put the first 3 letters and then the first couple letters to the first name, it usually pops out. If there's not a lot of common names, you can always look up further like this and make sure that you are choosing the correct name. In positions, you may see where it says virtual nurse for these type of nurses. And then you will continue documenting. Make sure that when you are documenting an injury that we are putting the length, width, and depth of the wound. So make sure that you are measuring and you're taking pictures as you're supposed to for every admission. Once you have documented the assessment of the skin in Cerner, you can reach out to the virtual nurse and let them know that you have completed the documentation. The virtual nurse will then log into Cerner, review the documentation, and make sure that they are in agreement with what you have documented. Then the virtual nurse will log into Cerner and complete a clinical note confirming that they have served as the second RN witness to a skin assessment on admission to confirm that they are in agreement with what was documented.